Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic is the lower gastrointestinal cancers. And we covered the upper gastrointestinal cancers in our previous lecture. So now we will talk about the lower gastrointestinal tract cancers and lower GIT. Upper GIT, if you remember, was esophagus, then we have stomach and small intestine, which is duodenum, jejunum and ileum. And now today we will talk about lower gastrointestinal tract, which will cover the colon or large intestine. Then we have the rectum and the anus from where the fecal matter passes. So the colon is large intestine and there are three sections of the colon. We have ascending colon, transverse and the descending colon and sigmoid colon. So actually four parts of the colon will be, and then we have rectum and the anus. So all these are the parts of the lower gastrointestinal tract. So today's topic, we will cover it in the 5 sections. In the first section, we will discuss the lower gastrointestinal cancers, then colorectal cancer, and then we will talk about the pathogenesis of the cancer at the molecular level or at the very low microscopic level. So molecular pathogenesis of the colorectal cancer. Then in the second section, we will talk about some risk factors that can lead to colorectal cancer, which may have dietary factors are very important risk factors for the colorectal cancer. Then we will talk about some other syndrome associated with the colorectal cancer, polyposis, coli, and MYH-associated polyposis, hereditary non-polyposis colon cancer. So all these will be discussed in our today's lecture, and all these are the contributing factors or the risk factors associated with the colorectal cancer. Then in the third section, we will talk about the prevention and screening of the cancer. How we can prevent the colorectal cancer, what's the primary prevention, what are some screening methods used, and screening methods, some of them are really very helpful in the early diagnosis of the colon cancer. And as we already know, the early diagnosis have the better prognosis. So colorectal cancer has the ability to be diagnosed early at the early stages, and treatment is good, and the prognosis is also very good. And then in the fourth section, we will talk about the staging and the treatment options for the colorectal cancer and what's the outcome of the treatment of the colorectal cancer. Then in the fifth and final section, we will talk about the last part of the lower gastrointestinal tract. We already mentioned colorectal. So colo is for the colon, we have ascending colon, then we have transverse colon, descending going down, and the sigmoid colon, the last part of the colon, and after that there is a rectum and then the anus. So in the fifth section, we will talk about the cancer of the anus, clinical features and the treatment option for the cancer of the anus. So all this will be covered in our today's lecture topic. So keep watching sqadia.com to know about this topic more better.